Hi, everybody. I'm Dr. Adam Mathews. I'm the executive director and owner of Mathews Counseling. And I want to just talk to you for a second about a federal law that went into place at the beginning of the year that requires anybody that's working with a license, particularly people in healthcare, that includes behavioral and mental health, it requires us as providers to provide you, the client, with what's called a good faith estimate. It's a part of the No Surprises Act. And there's a lot of good things about this law, right? Because it requires people like your doctors or surgeons, dentists to give you an estimate of what you are going to have to pay for their services and to give you a reasonable estimate about what it's going to take to essentially heal you. Right? If you're going to a doctor for knee surgery, for example, it helps you not be surprised by a bill later when that comes up. And somebody like an orthopedic surgeon can provide you, say, this is the estimate of what it's going to cost. And if it costs more than that, this new law says if they surprise you with unexpected cost, that then there would be consequences for that. So as mental health providers, as therapists, as counselors, we also fall under that law. And so we've been working hard since the first of the year to really implement that, to get our clients good faith estimates. When new clients come in, we're providing that with them as best that we can. Here is the problem, though, when it comes to therapy. And it speaks to a way that we see healing, a way that we see moving through our mental health challenges and therapy in general, is that it forces us, in a sense, to go against what we know to be true about therapy, right? Because something like a good faith estimate says there's a starting point and there's an ending point, right? And you should be able to know what that is going to be. And we run into this a lot when we have clients that come in and they want a fix to the pain that they're in. Whatever the pain point is, they want a fix to it right away. And we tend to want that as humans. We want to think of it as in terms of we can get to a certain point and then everything's okay, right? No matter how much we know logically, right, that we're going to face problems in life, right? We're not going to have one solve to everything and then life is going to be easy. We desperately want that, especially when our pain point is really high, right? But what is really important is coming back to this idea that especially therapy, right, working through, and just any kind of change or working through change in our lives there's not a stopping point. There's not a fixed destination where we're going to get to and everything's going to be okay. And it's not the same for everybody, right? Now, there may be points where you go, I need more or less therapy, right? Or sometimes people all the time take long extended times off from therapy because they've done a lot of really hard work to get to a place where they feel like that they can handle what they're facing on their own. Because let me tell you what I believe is the goal of therapy. The goal of therapy is to help you uncover the strength that you have to deal with whatever issues life is going to throw at you. And sometimes that's short. That may take a couple months. Sometimes that is longer and may take a couple years. And there's no way to know because it's a discovery of yourself. Our goal is to help you chip away at all the things that the world, that life, that your experience has taught you is detrimental about yourself, that has taught you that you can't handle things. Our job is to strip that all away, to help you identify what those things are, whether they're thought patterns, whether they're emotional experiences, whether it's trauma, whatever it is that you have gone through in life, whatever is holding you back from believing that you are capable of handling whatever life throws at you. Whatever that is, our job as therapists is to help you identify those things, give you tools and strategies to strip that away. Sometimes tools and strategies that help you deal with whatever you're facing in a better way, in a way that's more congruent with who you are and the strengths that you possess. And that is what therapy is supposed to do. And there is no way that I, as a professional, can give you a hard and fast date of when that is going to happen or how many therapy sessions that it's going to take for that to occur, right? Because you are the one that has to begin to understand what you need, what is helpful for you, and what is helping you move forward. Because it's a cliched phrase for a reason, right? It is not about the destination, it is about the journey. It is about the process that you are going through and how you are being able to handle the pain points in your life, right? And so while we will provide you with the very best estimate that we can, right? We cannot give you a certainty that it is going to be done by this date, right? Because therapy is not about you coming and us fixing it for you. It is about us it is about us helping you discover yourself, your strengths, and how best you can go about handling the issues that are going on in your life, right? So I just wanted to stop on and help and put that in front of you, put that as this idea that the GFE is here and you're going to see it, you're going to get a good faith estimate from us, you should get that from any therapist that you go to see now, but it does have some implications over how we think about therapy and how we think about therapy and what we're doing is so important. All right, so I hope that's helpful. If you have questions about that, shoot us an email, give us a call, and we'll help walk you through it if you have any questions about that. We'll also give you our philosophy of therapy and how we approach change and healing. All right, everyone, have a great day.